Hey everybody, Dr. Jess here from Premier Physical Therapy, and we're going to be wrapping up our video series this week. So last topic is it normal to experience some loss of motion or stiffness for a long term after breast cancer? Let's talk about that. Now, quick answer, no, definitely not, okay? So again, let's go to the research and let's look at this. So we're talking about 5 years after breast cancer treatment, okay? Individuals that received early intervention, okay? So they were able to get to this quickly, okay? 9% of those presented with some sort of continued limitation with shoulder motion, whereas 43% of individuals that did not participate in early intervention had some shoulder limitation long-term after breast cancer. So coming in, getting treated, and getting moving normally decreases your chance to have any sort of long-term effects to down to 9%. If you do nothing, your chance of having long-term limitation is as high as 43%. So it's just, let's follow the evidence and let's use that to guide our decision making. What contributes to immobility or difficulty returning to that normal motion? Well, a couple things. We've got a sedentary period and poor posture that can happen when we're trying to recover from breast cancer. We could have shoulder joint stiffness, stiffness also in the spine, in the thoracic spine. We could have some scar tissue adhesions that limit the mobility, and axillary cording can also limit your ability to return to normal motion. Now, why would a sedentary period lead to immobility? Well, let's go into the physiology. So what is needed for normal motion? Well, we need normal mobility in the spine. We need normal mobility in the, what we call the myofascia, and we need normal mobility in the muscles and normal mobility in the joints that are like the peripheral joints. So the shoulder joint is the most common one we'd probably be talking about. Now, if you've been recovering and you're sitting in this slumped posture, okay, over time, and you're kind of in this forward posture, sitting on your bed, sitting on the couch, going into that forward head, that head's kind of coming back, okay. What that can do is it can lead to stiffness in your spine, in your back, in your mid back. Then your pecs are in the front of your chest, okay, those get kind of tight. And over time, those muscles shorten down. Now it's like, now I'm kind of a little bit kyphotic, stuck in this posture, and I'm having a little bit of a harder time sitting up straight. It's harder for me to maintain that. Well, in order to have normal range of motion of the shoulder, I have to be able to actually get my body upright. And if I can't, because I've got this tightness, then I start to get some pinching in the shoulder and then it hurts and then I stop moving as much. And over time, I start getting stiffer and stiffer. Maybe my rotation starts to decrease. Maybe my neck motion starts to decrease. And it's like, man alive, like I had cancer, but geez, I feel like I'm way older than I am. Okay, so we don't want that to happen. Like this is all treatable. Types of stiffness. So we're going to talk about joint stiffness. We could have stiffness in the glenohumeral joint or the shoulder joint itself. We could have stiffness of the scapula along the ribs. We could have stiffness of the ribs themselves. The ribs need to move in order to inspire and expire, okay? And there's some rib motion as well with shoulder motion. We could have stiffness in the mid back or the spine or in the hips. I think if you're sitting for a while and you're not putting that hip into full extension by doing a lot of walking, then the hip could get tight. All of this is just from immobility. All right, so muscles could get tight as well. So we have this cross pattern that typically happens. So if you see in the upper body here, we've got the muscles in the front of the chest, like I said, they like to get tight, okay? And the muscles in the back of the neck like to get tight. Who doesn't have tight upper traps? I mean, come on, right? So that's that cross pattern that we see. And then that starts to limit our ability to move our head and to achieve the upright posture. But if we've been sedentary for a while, what can also get stiff and tight are the muscles in the hips. So the muscles in the front of the hips, the psoas in particular, tends to get tight, and the muscles in the low back tend to get tight. So now I'm like, oh, I'm going to go out for a walk. I'm going to really get going. And it's like, man, I'm like moving slow. My back is hurting. I feel like I can't stride like I normally could. And then you get discouraged. So this is all things that can happen. They're very treatable. We just need to get in there, get some motion into the back, get some motion into the hips, get some motion into the upper body, and then boom, there's that gait pattern, comes right back. You're like, oh, cool, I feel good again. And then you're off to the races. Common muscles that are affected after breast cancer. So again, these are the muscles that are close to where the surgical site was. So we've got the muscles on the front of the shoulder blade, the pectoral muscles, the muscles along the shoulder blade, and the muscles, the serratus anterior, which is right along that rib cage in the armpit area. They can all develop different sorts of pain, and that can lead to lack of range of motion because it hurts to move. So that's, just again, discouraging. The more we don't move, then also the less we move, and then the more stiff we get. Now, scars. Scar tissue may also prevent normal mobility. So if we see this individual here, we can see how much the fascia that's encasing all of these muscles needs to be able to slide and glide and move to create normal motion. Well, when scars start to bind down, they can start to limit how much we move, which again is discouraging when we're trying to get back to achieving that high level of activity that we're hoping for. 30 minutes of regular activity so that we can achieve those cardiovascular health benefits. And axillary web syndrome. So this as well, if you're trying to raise your arm and you've got this really big pulling or limitation that is felt along anywhere from the forearm to the elbow to the armpit itself, you will not be able to raise your arm the full amount. And we definitely want to make sure that we address this so that you can get that normalized motion back. All right, so these are the main things that can contribute to difficulty with returning to normal motion. Please shoot me an email, give us a call. You can check out our website, premierptjax.com, and see if we can get you moving a little bit better. And that's going to overall help you to return to that high level of activity and get just better quality of life. I mean, nobody wants to be stiff and not able to move. So all very treatable. Okay. All right. Thank you for watching our series, and we hope that you're able to get out there, participate in the virtual 5K, the Dawn Foundation 5K, and encourage those around you in your community to also participate and to share this video if it's something that you think somebody in your life might benefit from, and learn a little bit more about why maybe they're not moving well after breast cancer. Okay, let's spread the word. We're a big community here. All right.